Hi there, I'm going to be talking about isolation, different types of isolation, different types of equipment, and how to take care of a patient in an isolation unit. First and foremost, I just want to talk a little bit about isolation precautions. We use standard precautions for every patient that comes into acute care. And standard precautions are universally used with any patient that comes into the hospital, in the office environment, clinics. And the assumption is this: any secretion coming out of the body, no matter who you are, is considered a potential contaminant. Because in sometimes we don't really know if a patient has a communicable disease or not. So anytime that a nurse takes care of a patient or is seeing a patient in the office or in the community, we assume that any secretions are potential contaminants, and we wear gloves. So we wear gloves. If they give you a tissue full of mucus, any secretion from the mouth, emesis, stool, urine, anything of that nature, okay, we will handle it with gloves. Other parts of standard precautions are also double bagging of grossly contaminated bloody. It has to be soaked in blood, dripping, or another gross contaminant that we would double bag in biohazard bags are when we recently, a while back, had Ebola. There was a contaminant. The contaminants were a lot of vomitus and diarrhea and stool. So that would have been double bagged. But for the most part, small amounts of wound drainage or peri pads for people who are menstruating are not considered biohazard material and wouldn't be placed in a biohazard bag. But that's part of standard precautions. Also part of standard precautions are sharps. The use of sharp box for all sharps, properly disposing of those. And these are some examples of standard precautions we utilize for everyone, every patient. Now, when we talk about transmission-based precautions are implemented for patients who have a known communicable disease or suspected one. So there are many that I'm going to talk about and many that you're going to learn about. But there are three main categories per the CDC, per the World Health Organization. And the three categories are your airborne precautions, your droplet precautions, and your contact. Now I'm going to talk first just a little bit about your airborne precautions. Airborne precautions are utilized when we have a very fine microbe that can be transmitted in the air currents. And as a result of that, this type of patient is placed in what we call a negative pressure isolation room. Negative pressure isolation, what it does is it pulls the air out. There's usually 12 air exchanges per day, and it ventilates the air in the room out. In order for the negative precaution room to be utilized, airflow, the door needs to be shut. Also, with airborne precautions, we wear what's called an N95 mask. The N95 mask provides an immense amount of protection, not only for exhalation, but for inhalation. Now, the N95 masks come in small, medium, large, and extra large. And in order for it to fit appropriately, you have to be fit tested. So when you have this mask that you place on your face, okay, when it's fit tested appropriately, when you inspire, it will collapse slightly, and when you expire, no air will come out of your mask. This is an N95, and it's only supposed to be used, I know you've seen different things on the media lately because of COVID-19, once only for each patient. This is another N95 Piper mask, okay? And this does the same thing, okay? So when you have a person on airborne isolation, they're in a negative pressure room, you wear an N95 mask, gown, and gloves with every entry into the room. Examples of disorders that are considered per the CDC, airborne isolation candidates, so to speak: TB, measles, disseminated herpes, chickenpox, and of course, recently, COVID-19. The next type of isolation that we have is called droplet precautions. Now, droplet precautions are disseminated when the patient coughs, sneezes, or talks. So it's in larger droplets. And what is protective for us as healthcare providers for this type of isolation precaution is either the surgical mask. These are all surgical masks, okay? And I'm gonna put one on and show you how to properly put one on. Surgical masks, again, provide barrier. So if somebody sneezed on you, that's a barrier, so you won't get it in your airway. But it really prevents, that's why we're using them with COVID-19. If we're contaminated with something, it's gonna prevent the person around you getting that contaminant or that communicable disease. So with droplet isolation, you're gonna wear a surgical mask. These are different types. You're gonna wear gown and gloves when you go into the room with every entry. And examples of things that are considered droplet isolation are H1N1, influenza, whooping cough, also called pertussis. These are examples, strep throat, mumps. These are all things that are in the category of droplet precautions. The last type of isolation category are contact precautions. What this means is that when I come in close contact, 3 to 6 feet of the patient, there is something from their skin surface or some sort of secretion that if I come in contact with it, it's communicable. So for this, you're going to wear gown and gloves. Now, contact precautions, examples of disorders or communicable diseases that fit in this category according to the CDC are MRSA, methicillin-resistant Staph aureus, Clostridium difficile, vancomycin-resistant enterococcus, CRE, hepatitis A. So these are all examples of what would be considered a potential contact transmission. So, I've already talked about all the masks. The other thing that you may need is complete coverage, like in Ebola. Ebola is droplet, believe it or not, but also complete coverage. So you'd wear a hair bonnet. You would also wear a booties on your feet. And you may wear a gown or what we call complete coverage. Okay. This is like a suit. This is what you should wear for that, complete skin coverage. And you'll learn more about that in disaster nursing. Now, the other thing that I want to talk about is if you have a blood spill, which is potentially contaminated, if the person has hepatitis or if the person has HIV. These are blood spill kits. They have Clorox in them, and you would put it into the blood spill and gown and glove, and it goes into a special biohazard bag. There are different sizes of biohazard bags. This is a smaller one. This is a larger one. Again, anytime you put something in a biohazard bag, it's got to be double bagged. So if I'm in this room and I have a biohazard material, the person on the outside of the room has gloves on will cuff the bag, and I will put the contaminated bag into that bag, and then it will stay at the door and then get picked up and put in a biohazard container. There are also special biohazard bags for chemotherapeutic medications, which can be very toxic to the skin. The biohazard bag that you will use a lot as a nurse is a specimen biohazard bag. The specimen biohazard bag it's kind of twofold. The specimen will go inside of this bag, and then it has an outer pouch where the paperwork will go. Okay. The other thing that I did not show you is the face shield that our college makes here. This face shield, which you would use for COVID-19, fits around the head this way, and again, it's that droplet splash being a protective barrier.